I still a little protected because that was a habit I had.
The problem I have with my hip, uh, I'm pretty active. I do a lot of hiking and play a lot of golf and do a lot of yard work around the house, and it was getting to where it was really hard to do that. I was so uncomfortable having to take a lot of pain medication just to finish a round of golf. And after about 12 holes, I was limping pretty bad. And so I decided to go ahead and do it. And when I made the appointment, the appointment clerk wanted to know what I needed, and I said, I want to make an appointment with Dr. Broom. And she said, what for? I said, I want to interview him. And so that's basically what I did. I came in and told him what I felt like I needed, and just asked him all kinds of questions, and because I knew the answer to some of them, and I guess they're called loaded questions, and he had all the right answers, and just his demeanor and his friendliness, and just sold me. On my right hip, the one I had done 4 years ago, the procedure they used, they went from the back or posterior, and actually it was a minimally invasive surgery, but it was from the back side of the hip, and I know it was compared to this one that I had, the one that Dr. Broom did, he went through the front, which is anterior, and I would, my first hip, 3 days I couldn't get in the bed. All I could do is stay in a recliner. With this one that I just had done, I got in bed that night. The next day I could put my socks and shoes on without using that device to put them on with, and it was just a tremendous difference. And I'd recommend that to anyone that is considering having hip surgery. The difference in this procedure that Dr. Broom did, 3 weeks, I was back on the golf course. I played 9 holes exactly 3 weeks after my surgery. I went home 5 o'clock Monday. Could have gone earlier, but I decided to stay for dinner. The food's really good. And so the next day, I wasn't sure that I could do this, but I decided I feel pretty good, and I didn't have to use any crutches or walkers or anything. And so my wife drove. Actually, I sat on the bar stool and played the banjo for 2 hours in a jam session, and actually no pain. And I couldn't have done that had I done this surgery the other way. It's very important to me to be active. I actually live in a golf community, and that's one of the big things that I do. I have a couple groups that I play with, and it was getting to where I couldn't play once a week. And now I'm excited about being able to play maybe 3 or 4 times a week. My life has changed. For one thing, my family doctor told me I need to get off of all that anti-inflammatory medicine I've been taking. It's not good for your stomach or your liver or whatever. And so I'm off all that, and actually I think I can actually tell the difference, because some of the ringing in my ears is gone, and I think that was from some of the medication I was taking, and have zero pain in my hip, and actually I'm looking forward to get back into hiking a little more. My goal is, I don't know if I should say this or not, but my goal is to hike the AT when I'm 70, and I'm 68 now. So I think by the time I'm 70, I should be good to go, as long as none of the other parts fall out.